All right, Dr. Joy, can you please kind of explain kind of what you do and kind of why you chose to do the thing you're doing right now?
You got it. So, as you can probably tell, I'm in my car. I just finished doing an extraction on a person who is homebound, and I go to about 18 different long-term care communities. They don't like to be called nursing homes anymore. I have absolutely no idea why, but I go to 18 different long-term care communities. This particular person I saw is in assisted living. And so she needed a tooth pulled. And so I brought all my stuff and I created an area for my instruments and got her numb and pulled the tooth. And now I'm going to be after this. I'm going to be going home. So this was a day after seeing my patients in my brick and mortar practice on the north side of Chicago. So yeah,
Okay.
so I am I guess you can call myself a nursing home dentist, a house call dentist. I go
Yeah.
to homes, I go to people's homes that have chosen to stay in place, and I do
Hmm.
everything from cleanings, exams, anything you could possibly want with a denture, because I've got a great denture guy who totally understands the population that I'm dealing with or working with. And then I work with assisted living, memory care for those that are living with one of the dementias, skilled
Yeah.
nursing. Yeah, so that's what I do.
All right. Amazing, amazing. And kind of like since you're doing like in-house and also you have your brick and mortar, how are you able to balance both of them?
Very carefully. So scheduling wise, what I do is I have open dental for my software system. And
Hmm.
then, so those are my patients that are coming into the office, and we separate them. We meaning me and my staff. We separate them by putting notes, and we color code the notes. So the light blue notes in my schedule are my patients that I'm going to, not that are patients that are coming to me. So
Okay.
scheduling wise, that's how we separate it, and we base it on, ideally, a home. So at the top part of that note, I'll put down, for example, I'm currently in Lincolnwood, so I Lincolnwood
Hmm.
Place, and then we put a list of patients that I'm seeing with their room numbers, and then what I'm doing for them. So
Okay.
that's how we separate it. How do we do it schedule wise? Honestly, it's when I have slow time. Sometimes
Mhm.
it is, when, from the time between 10 and 2, 10 and 3, when a lot of, the working, people that are working, even if they're working from home, they're still, it's difficult for them to leave their home to come to the dentist. Those are the
Yeah.
times that I'm leaving the practice to go to people that can't come to me so that I can treat them there. And that fills in my schedule. And that works out really well. I also go on Fridays. All day Friday, I'm going to people's
Mhm.
homes, and I choose to do that because Fridays were my weakest days in my office. And so I opted to
Hmm.
do this. And that fills in my schedule. I have a little bit more independence. I'm kind of free from my practice. I get to choose my schedule on where I'm going and who I'm seeing and what I'm doing. And I'm still producing, which is really nice.
All right, that's really amazing. And can you talk a little bit kind of more about what type of I guess services that you're offering? Like, are you doing only dental implants, or do you also do Invisaligns and orthodontics and all that?
Right. So I don't do any dental implants. And in fact, I don't even like to restore them, quite honestly. Too many parts, too many parts.
Yeah.
But I'm your denture girl. Anything you could possibly want with a denture, you're looking at her. I work a lot better with dentures, and there are people that cannot have implants.
Yeah.
They've either waited too long, so so they don't have the bone anymore, or they have osteoporosis, so they've got brittle bone, or there's other issues that, not just even financial, just medical issues that prevent them from getting dental implants. And so those are the patients that I see. And then I do Invisalign, but I only do Invisalign for adults. I want to make sure that I'm working with someone who's not growing or developing. I don't want to be
Yeah.
working with a growing jaw. I leave
Hmm.
I leave the children, the adolescents, to the orthodontist. They have the extra training. So as a GP, I'm only going to be doing adult Invisalign. I
Okay.
also find that I have a lot better patient. They do a lot better, right? They actually want to do it. They're paying it for it themselves. I get a lot better results than having to deal with the adolescent or the children, where not only am I dealing with the kids, but I'm dealing with the parents on top of it. And if the parents aren't involved, then are we going to get a really good result? Probably not. So
Yeah,
that's
definitely.
I leave that to I leave that to the specialists.
Yeah.
But I also like to do spit tests. I'm a firm
Hmm.
believer in knowing what type of bacteria are in my patients' mouths.
Yeah,
So
gotcha.
if I have a patient who's got refractory periodontitis, where we're doing all the things, the patient's coming in every 3 months. We've done run round of the chlorhexidine. We've done laser therapy for the gums, and I'm not getting any improvement. I'm going to have them do a salivary test. I want to see what the bacteria are causing these problems. Are they anaerobes? Are they aerobic? Which
Yeah.
bacteria are causing this? And so that's very important to me, and that's a crucial part of my practice, that I make sure that we do spit tests and I send them out to the lab in Minnesota. It's called Oral DNA, and I love them.
Hmm.
And they give a really good explanation, not just for me, but for the patients as well, to understand what's going on in their mouths. And then we dedicate their treatment based on the bacteria they have in their mouth. And I really see this as being part of the future of dentistry.
Gotcha, gotcha. Yeah, I think 100%. I'm with you. Like speaking to a lot of other like kind of dentists and stuff, I see that that's kind of where it's going to. I guess like can you t tell us a little bit more about like your education, like why you chose being a like dentist and all of that stuff?
Absolutely. Braces. Yeah, so I got into dentistry for revenge. No, I'm
Oh.
kidding. I did I did braces for 4 years, and I was very happy to have straight teeth again. And
Mm,
my parents, say I had to save money. My parents were teachers, 4 kids. So they literally saved money for me to have braces. And that was huge
yeah.
because I really saw the value in them. And so I
Hmm.
thought I was going to be an orthodontist. I got to college, and we're all sitting around one day talking about our future careers. And it came to me, and everyone started laughing at me. I'm like, what's going on? And this guy was like, oh, I used to, fling my rubber bands at my girlfriend across the room. And this guy's like, yeah, I told my mom I was going to the orthodontist, but I really was playing basketball with my buddies. And I'm like, whoa, whoa, whoa. I'm not going to deal with non-compliant kids and then their parents on top of it. Forget it. So even before I knew I could get into dental school, I'm like,
Yeah.
ortho's not for me, not for me. So
Mhm.
yeah, so I became a GP, and then I do adult Invisalign. So I got the best of both worlds, and I feel I have a lot more freedom in what kind of dentistry I do, and I also have a lot more control in what kind of dentistry I do because I'm a GP. I can do other things if I so choose.
That's amazing. That's amazing. Gotcha, gotcha. Yeah, yeah, definitely. Because I remember as well, like around like 2 years ago, I used to have like those braces and stuff. I couldn't even like eat an apple and stuff like that. It
Yeah,
was just very, very like painful and stuff. But yeah, I guess. I guess how's the Invisalign kind of going? And can you explain a little bit of how the process goes from like starting it to like finishing it and everything looks good?
absolutely. So you have to understand when it comes. So I specifically work with Invisalign. I don't work with any other kind of clear aligners.
Okay.
I've seen other clear aligners. I'm not going to mention any names, but I've seen them. I've had salespeople come to my office, work with me on them, and I still feel that Invisalign gives the best quality of care, meaning that they really have their algorithms in place and moving in the tooth movement tray to tray. They also provide incredible education. So yes, Invisalign is probably it is the most expensive one out there, but the amount of education that you can get, the CEs you can get from quote unquote Invisalign University online is absolutely superb. And whenever I have an issue, I can talk to an orthodontist. There's no additional charge on that. We go over the
Yeah.
case. I love that. You don't get that anywhere else.
Mm,
So start to finish, they only work with iteros. So I've got two iTero scanners in the office. I've got the old Element and I've got the new one. I forgot what it's called, irrelevant. But
yeah.
I have the new one. Of course, my staff like the new one.
Yeah.
And so, yeah, so we do the scan. And then what we do is that we do the Invisalign simulator. So the patient right there in the chair can see a before and after.
Yeah.
And in so doing, they can have a little bit of an idea of what their teeth can look like post Invisalign. And
Okay.
that is a really good sales point, but it's also a really good educational point because it gives them an idea what has to be moved in order to achieve the smile that they want.
Definitely.
Once
Yeah.
they approve that, yeah, once they approve that, we take pictures. We're
Hmm.
required to take 12 pictures. So we take those pictures, we get those into the system as well, and then we send everything off to Invisalign. Now, at this point, I have not collected a dime. Okay. And the
Mm,
reason why is once again, I want the patient to really approve how their mouth is going to look by the time, because at this point, there's been no charge from Invisalign, right? They
okay.
haven't
Yeah.
charged me anything. It's not
Yeah.
until I press send for the trays that they charge
Mm.
me. Okay. So if
Okay.
they haven't charged me yet, I want to be working with the patient to make sure they approve their smile, because I might think their smile looks great, but they might still see that snaggletooth they remember when they were 12. Do you know what I
Definitely.
mean?
Yeah.
So
Yeah.
I want that patient to feel like they have a little bit of control in the situation.
Yeah.
That works so well. So then they're like, yeah, that looks fantastic. I might have to finagle it a little bit with, with the lab, but I'll, finagle it, do that, send it back to them. I email them now, the before and
Hmm.
after based on the algorithms. They're like,
Yeah.
yes, doc, that's what I want. I then forward it, then we charge, and I generally speaking, I like it all up front, but we do it
Yeah.
all one lump sum. So no matter if it's Invisalign Go, where you're only
Yeah.
working with the premolars up, or if it's a comprehensive case, I'm charging the same
Hmm.
because I still have to do the same amount of prep work.
Of course.
Okay.
Okay. Yeah.
That's
Yeah.
number one. Number two, I also include the Vivera retainers. Now, the retainers are four, right? There's four sets. I
Yeah.
include all of that in one lump sum. So the only time that I'm not making, I'm not producing as much, the differential is not as high as if I have to do a refinement, right? Because of
Yeah.
course, Invisalign is going to charge, any of the labs are going to charge for a refinement. Okay. So
Yeah.
if there has to be a refinement, so my differential on, profit versus what I've charged, what Invisalign is charging me is going to be less. But
Yeah.
ultimately speaking, I'm getting the end result that the patient is going to approve, who's then going to tell others, who's then going to come to me
100%. Exactly. Yeah.
for Invisalign. And they like the fact that I don't nickel and dime. Do you know what
Yeah.
I mean? Oh, we have to do
100%.
Invisalign. We have to do, yeah, we have to refinement now. Now you got to pay for this. Oh, now we're doing the retainers. Now you get, no, 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 no. They know it all
Yeah.
up front. One
100%. Yeah.
fee, done.
Hmm.
Yeah. And patients appreciate that too.
I think so. That's definitely like the best move because like once, especially once they trust you, then that's like an infinite referral system where they can just bring you customers more and more and more. Yeah.
And let me tell you, it works because it's a number that they'll remember, that they can
Hmm.
carry on to, their loved ones or family, friends, neighbors, whatever. And
Yeah.
and it's really easy for them to understand and then for them to tell others. So
Yeah.
it
Hmm.
works. It works.
Definitely. 100%. Oh, that's great. That's amazing. And I guess like what kind of motivated you to start your own dental practice?
Control. I like to be in control.
Hmm.
What it came down to is the last place that I worked as an associate, I learned a lot from him. Learned a
Hmm.
ton from him. I learned what I
Yeah.
wanted to do, but I also learned what I didn't want to do. And one of the problems that I had as an associate was that the staff didn't always listen to me because I was just the associate. They sometimes didn't take me seriously. They didn't always respect me. They
Yeah.
listened to their boss. I
Yeah.
wasn't their boss. I wasn't signing their paychecks. So if I
Mhm.
asked them to do something, and we had a good rapport, we had a good relationship. I wasn't a jerk. You know what I mean?
Yeah. Yeah.
But
Yeah.
at the end of the day,
Hmm.
I wasn't signing their paychecks. And so therefore I realized that the only way I was going to get full respect and full response in how I wanted to treat my patients was by being
Yeah.
my own boss. And
That's
when I
amazing.
became
That's
my own
amazing.
boss, yeah, when I
Yeah.
became my own boss, that's when I got earned that respect. And I've
Hmm.
I've got staff now that have been with me for over 10 years. We're almost
That's
like
amazing.
family. It
Wonderful.
is,
Yeah.
because I treat them the way I want them to treat me. Right? It
Yeah.
goes both ways. It goes both ways.
100%. That's perfect. Yeah. So I guess like you've maintained like the private practice for like years. What kind of like have kept you going while many clinics kind of struggled? You know what I mean?
Yeah, no, great question. I don't have a hygienist. I do my own
Mm.
cleanings. So I'm not the richest
Okay.
dentist in the world by any stretch of the imagination, but I can tell you the relationships that I developed with my patients are fantastic. I can tell you that I can do same day dentistry. I find something, I'll do it. So for example, today I did, a cleaning on someone and her tooth number 26 had a incisal fracture. So I did an IF filling for her. Didn't even need to get her numb. Just had roughened it up a little bit, but I was able to do that
Hmm.
filling and the cleaning and the fluoride, all in one visit. So it's stuff like that. It's developing relationships with your patients that really mean a lot, and to show that you care and you empathize with them. That the first person they see is not going to be the hygienist. The first person they see is me. And so I've
Yeah.
developed a niche in the practice where they want to see me because we have developed a relationship. They trust me. And one
Yeah.
of the things that my associate says to me now is, Doc, she's like, no one ever questions your treatment plans. No
Hmm.
one questions it. You tell them what you need, what they need, you show them what they need, and they do it. That's incredible. I said, because we
Yeah.
developed a trust over the years. Do you know what I mean? And the
100%.
patients that are
Yeah.
coming into me, the patients that are coming to me now, new patients, are referrals from people that have already established that trust. So there's already kind of like a built-in trust with the new patients that are coming in. So yeah, so it's wonderful, and but I mean that takes a while. That takes time. Do you know what I mean?
Definitely. Yeah.
Like
Yeah.
I walked into a practice where the gentleman that I bought the practice from, and he was a young guy. He was in his late 30s, early 40s. He was
Yeah.
not taking full mouth series of X-rays.
Mhm.
Like, how can you find treatment if you are not taking full series of X-rays? He didn't want
Yeah.
to charge too much to the patient. What? You are doing your patient a disservice if you're not taking a full mouth series of X-rays. You have to educate the patient on the why that you have to do
Yeah.
this, right?
100%.
So
Yeah.
stuff like that. So it's develop relationship development. It is listening to the patient. 80/20. I talk 20% of the time, if you can believe it or not. I talk 20% of the time. The patients talk 80% of the time. I want them to know. I
Yeah.
want them to know that I'm listening to what they're saying and that it
Yeah.
matters to me. It matters to me what they want.
Yeah. 100%. Yeah. That's amazing. That's really, really good. So I guess like right now, what's your approach with like marketing and patient education? Like before they even
Yes.
come to your practice?
Excellent. So I hate my website. I'm not going to lie to you. It's not great. I've redone it twice. This is my third iteration of my website, and I still don't like it. I probably should do more on Instagram. I don't. I'm
Mm-hmm.
52. I'm 52.
Uh-huh.
So for me, that's I gotta I love LinkedIn, but that doesn't really do much for patient building. That's more for me
For more
developing more
connections.
relationships with nursing
Yeah.
homes. Yeah, yeah,
Mm.
and doing podcasts and stuff like that. But yeah, so
Yeah.
what should I be doing? What I should be doing is more Instagram. But yeah, so I'll get there eventually. It's a New Year's resolution, maybe by March. I don't know.
Hmm.
But yeah, but honestly, it's word of mouth, and there's a company, it's a third party company called Open Care, and
Yeah.
somehow they found me, and how it works is this: if the patient gets any treatment, I pay $150 for that patient flat.
Yeah.
And
Okay.
then and every patient has to have a PPO insurance, no
Hmm.
HMOs, no Medicaid, none of that. And then
Okay.
we have developed fantastic relationships with these patients as also with Open Care. So we have a 5-star review on Open Care. And so
Amazing.
patients like coming to us based on finding us through Open Care. We do nothing.
Yeah.
They do all the marketing. They take care of it. I think $150 a patient for everything that they do for us is fantastic, and
Yeah.
they maintain my 5-star rating.
Hmm.
You can't beat that. That's priceless. So that
Yeah.
is a
Yeah.
major feed. Besides word of mouth, Open Care. I do no marketing beyond that. Now, when I
Okay.
first
Gotcha.
started, when I first started, my boss is like, you advertise everywhere. You advertise, the jewel carts. You advertise on those carts. You advertise everywhere. Billboards. You advertise everywhere. First 2 years, let
Yeah.
everyone know where you are, and then you start peeling back. You start peeling
Yeah.
back. You start peeling
Hmm.
back. And
Hmm.
now, so I've had my own practice now since 2006. If you can believe this one, I literally
Hmm.
closed on my practice 666. June 6th, 2006. I am not kidding. So yeah, woohoo, go Dr. Joy. But yeah, so I've had my practice since 2006, and I that's all the marketing I do is Open Care, and that's $150 a patient. And
Okay.
that's
Gotcha.
worth to me,
Gotcha.
that's worth every penny, and I don't do any other marketing than that. Could I?
Hmm.
Sure. Do I think I need to? I'm really happy with how the patient flow is. Like today was a slow day. I'm not going to lie, but I don't know
Hmm.
if marketing for the last 3, 4, 6 months would have built up this day anymore anyway, quite honestly. Do you know what I mean?
Yeah.
Yesterday
Definitely. Yeah.
was,
Definitely.
I mean, it's one day. Yesterday we're slammed.
Hmm.
Tomorrow we're slammed. Thursday we're slammed. So, it's one day.
Yeah.
I'm not going to chalk that up to poor marketing. Do you know what I
Yeah.
mean?
Gotcha. Yeah.
Yeah.
Yeah. Yeah. Yeah. So I guess like what's one big goal like you have for the next 5 years from now for like your practice or like dental care in general?
Yeah, no, I think that's a great question. And so, my hands aren't going to last forever. So I've begun to think about my third of my career, right?
Mm.
My first
Yeah.
third, you ramp up, you learn the difference between working fast and working efficiently. You would learn about
Yeah.
time management. You learn about your strengths and your weaknesses. You learn what you
Yeah.
like to do, what you don't like to do. Your second,
Yeah.
third is what I'm kind of like in right now. I'm practicing the way I want to practice, doing the things that I want to do, and referring things that I don't want to do. Right. And then your third is like, okay, do I start to slow down? Do I look out for other venues? And I am looking out, I'm looking at other avenues. And those avenues
Yeah.
are speaking engagements. So right now I'm
Hmm.
talking very heavily. I've spoken at Midwinter. I've spoken at Greater New York. In April, I'm going to be speaking in Midwest in Kansas City. So I speak now at dental conferences. I guess you can see I'm on the lecture circuit talking
Yeah.
about geriatric dentistry, having dentists understand the different types of dementia, learning about the different medications that patients are on now that they're getting earlier and earlier diagnoses. So someone with
Yeah.
Alzheimer's that's going to be coming into your practice on
Hmm.
drugs, you should be able to know how to handle this patient, right? And then
Yeah.
I've also begun talking about menopause. So my goal is then to get paid and get sponsored to be talking to dentists, dental teams, what regardless, at different conferences. And that's how I want to be traveling. I want to be educating. And this way I don't have to use my hands, but I'll be, generating revenue. And this is something that I
Yeah.
want to be doing. When am I going to be selling my practice? I don't know. I don't know. In the next 5 years, maybe 10. I don't know. But what I do want to
Mhm.
be ramping up is more speaking engagements and more education.
That's amazing. That's perfect. Well, thank you very much for your time. That was an amazing podcast. And